Hello, this is Akram Jafar, and I am going to deal with the lymphatic drainage of the upper and lower limbs. I will start with the lymphatic drainage of the lower limb. In the lower limb, there are superficial inguinal lymph nodes. There are about 10 nodes divided into two groups, either a proximal group, which is just distal to the inguinal ligament, or a distal group that lies vertically along the termination of the great saphenous vein. Remember that the superficial lymphatics usually they accompany the superficial veins, and so these lymph nodes are closely related, as well as the lymphatic vessels, to the superficial vein in the lower limb, which is the great saphenous vein. These superficial inguinal lymph nodes drain superficial tissues, that's to say everything superficial to the superficial fascia. Actually, they drain the entire lower limb except for a small area which is located in the posterolateral part of the calf. This area of skin is drained along lymphatic vessels that accompany the small saphenous vein, the other superficial vein in the lower limb, and they drain to few lymph nodes that are located in the popliteal fossa, called popliteal lymph nodes. In addition to the lower limb, the superficial inguinal lymph nodes drain the lower abdominal wall below the umbilicus. They also drain the skin of the back below the waist, as well as the skin of the gluteal region. And also they drain the external genitalia, excluding the testis, and we are going to deal with that in a moment, why the testis is excluded. The scrotum and the external genitalia, they drain to the superficial inguinal lymph nodes, but the testis is not, because the testis actually develops in the abdomen, then it descends down to the groin, and so as it is descending, it will drag its blood supply and the lymphatic vessels with it. The same thing is true for the other gonad, which is the ovary, but the ovary does not descend to the groin, it descends down to the pelvis, yet the lymphatics of the ovary, they will drain to the abdomen. The other structure that is drained by superficial inguinal lymph nodes is the perineum, and this includes not only the skin, but the lower part of the anal canal and the lower part of the vagina. In addition to that, there are few lymphatics reaching the superficial inguinal lymph nodes from the cornu of the uterus, and this is because of the communication between the cornu of the uterus and the inguinal region through the round ligament of the uterus that passes through the inguinal canal. So, inguinal lymph nodes are either superficial inguinal lymph nodes. We have just mentioned that they are in two groups, a proximal and a vertical group. Now, the second group of inguinal lymph nodes are the deep inguinal lymph nodes, and these are located medial to the femoral vein and in the femoral canal. They drain the deep lymphatics that accompany the femoral vessels, including those from the popliteal fossa. Remember here, those popliteal lymph nodes are located deep. Also, the deep inguinal lymph nodes drain lymphatics from the superficial inguinal lymph nodes. They pass through the cribriform fascia. Efferent vessels from the deep inguinal lymph nodes go to the external iliac lymph nodes in the pelvis. One lymph node from the deep group of inguinal lymph nodes has a special name and clinical significance. It's called Cloquet node, referring to the French physician and surgeon of the 19th century. This lymph node is the most superior of the deep inguinal lymph nodes, that it actually lies in the femoral canal. Here's the femoral canal that is located medial to the femoral vein, a weakness in the anterior abdominal wall. The femoral canal is usually potential space that is filled with fat and contains lymphatic vessels and the lymph node of Cloquet. These lymphatic vessels and the lymph node connects with the external iliac lymph nodes. This lymph node in specific, which is, as I said, the upper part of the deep inguinal lymph nodes, receive lymph from the glans penis or the clitoris, as well as the deep inguinal lymph nodes, and its identification and removal for biopsy during surgery can determine if a cancer has metastasized. So if this sentinel node is cancer-free, then further extensive lymph node removal may not be required, can be avoided, and this will reduce the risk of complications like lymphedema, as we will see in a moment how removal of lymph nodes might result in lymphedema in a limb. Now, so far about the lymphatic drainage of the lower limb. Now I will deal with the lymphatic drainage of the upper limb. Again, here we have superficial lymphatics that follow the superficial veins, and these superficial lymphatics from the lateral part of the hand, they will follow the cephalic vein, which is the lateral superficial vein of the upper limb, and these lymphatics will drain to infraclavicular group, which is located in the deltopectoral groove between the deltoid and pectoralis major muscle, and then vessels from the infraclavicular lymph nodes pass through the clavipectoral fascia to the apical group of axillary lymph nodes. I will talk about the axillary lymph nodes as deep lymph nodes. And then from the medial side of the hand, the superficial lymphatics will follow the superficial vein on the medial side, which is the basilic vein, and these are drained to one or two lymph nodes that are located just proximal to the elbow, and these are called the supratrochlear, or they call them epitrochlear, referring to the trochlea, which is the medial condyle of the humerus, or cubital lymph node, referring to the cubital fossa. And from there, the lymphatic vessels will drain to the lateral group again of axillary lymph nodes. So from the lateral side, they will go to the apical group of axillary lymph nodes after being filtered in the infraclavicular nodes. And from the medial side, they will be filtered in the supratrochlear lymph nodes, and then they will go to the lateral group of axillary lymph nodes. These are the superficial lymphatics, and the deep lymphatics, they follow the arteries, and they will end up in the lateral group of axillary lymph nodes. So what are the axillary lymph nodes? These are about 20 to 30 nodes. They are located in the fat of the axilla and are generally divided into 5 groups according to their location. So we have the anterior group, which is also called the pectoral group because it is related to the lateral border of pectoralis minor muscle. Actually, this pectoral group drains most of the lymph of the breast, lateral side of the breast. And then we have the posterior group. The other name is the subscapular group because it is located at the lateral border of the scapula, and it drains lymphatics from the back, the shoulder, and the back of the neck. Then we have the lateral group, which is also called the humeral group because it is related to the humerus. And this, as we have just seen, that it drains most of the lymph from the superficial and the deep lymphatics of the upper limb. And then from these 3 groups, lymph will be drained to a group which is located in the center of the axilla, called the central group. And then from the central group, lymph will be drained to the apical group here. Remember that the apical group also receives from the infraclavicular nodes. Physical examination of axillary lymph nodes is very important in cases of a mass in the breast because more than 75% of the lymphatic drainage of the breast, especially from the lateral quadrants, lateral side of the breast, they will go to the pectoral group of axillary lymph nodes, and then, as we know, this group will drain to the central group and then will drain to the apical group, and then from the apical group it drains to the subclavian lymph trunk. Now, what about the remaining 25% of the lymphatics of the breast? They will either drain to the parasternal lymph nodes that are located on the side of the sternum along the internal thoracic or internal mammary artery, or from the lower side, they will drain into abdominal lymph nodes that are located on the undersurface of the diaphragm. Some of them might cross and go to the opposite breast. But again, I repeat that most of the lymphatics of the breast, they will drain into the pectoral group of lymph nodes, which is also known as the anterior group of axillary lymph nodes. Axillary lymph nodes are not only draining the breast, they are draining other areas of the body. That's why an enlargement of an axillary lymph node does not necessarily mean that there is something wrong with the breast, because the axillary lymph nodes, they also drain the skin of the pectoral region in general and the abdomen above the level of the umbilicus. Remember, the skin of the abdomen below the level of the umbilicus is drained to the inguinal lymph nodes. And also they drain from the back, the shoulder, and the back of the neck, and also they drain the upper limb. So for example, an infected wound in the palm might result in enlargement of axillary lymph node, or an infected, let's say, piercing in the umbilicus might result in enlargement of axillary lymph node. But we can also expect that some of the lymphatics at the level of the umbilicus can drain to the inguinal lymph nodes as well. Now, as I have just mentioned earlier, that excessive removal of the lymph nodes and the lymphatic vessels will affect the normal lymphatic drainage of the limbs, whether in the lower limb, remember the case of the lymph node of Cloquet, and or in the upper limb. So if this disruption takes place after the removal of axillary lymph nodes, like for example here in this patient, she's developing a lymphedema of the left arm 7 years after her breast cancer mastectomy and left axillary lymph node dissection. Sometimes radiotherapy might also affect the lymphatic vessels and result in fibrosis. And all this will cause disruption of the normal lymphatic drainage, resulting in lymphedema. Now, so far about the lymphatic drainage of the limbs. Now let's deal with the lymph nodes in the abdomen.